Hello there, welcome to Speaking of Business. I'm your host, Nancy Boyle. Today we're going to be talking about some affordable healthcare options for business owners and maybe a few other benefits as well. Joining me are Dr. Kay Holmes and Ellen Sullivan with Doctors Express Urgent Care Centers and Ray Strickland with Benefit Advisors. So welcome.
Thank you.
Everybody.
Thank you.
I'm really curious to hear about the urgent care centers. It seems to be a kind of a new concept. So Kay, we'll start with you, and maybe you and Ellen can tell us a little bit about what each of you do and your program.
Okay. My name is Kay Holmes. I'm a gynecologist in town. I've been here for about 20 years. Ellen and I started working in the different areas of healthcare, and Doctors Express is an urgent care center that we sort of started with, and we opened in October of this past year. And I'll let Ellen.
Sure. My name is Ellen Sullivan, and I'm a registered nurse. I've been in Jacksonville for over 20 years, and most recently had worked with a healthcare insurance company and was the head of quality. So both Kay and I are very, very passionate about affordable healthcare and quality healthcare. And Doctors Express is actually the first national system of urgent care centers. And so we did open the very first one here in Florida, and it's expanding very rapidly. There's over 40 centers now open in the nation, and there'll be quite a few more by the end of the year. Yes.
Excellent. Well, good. Well, we're going to hear more about it in a minute. I want to go to Ray.
Yep. Ray Strickland. I'm Regional Director for Benefit Advisors here in Jacksonville. And we're part of a company that really wants to help businesses create a better place to work. And we do that primarily by providing unique insurance and HR programs that are very tailored, very specific to the business goals. We work with a lot of large companies, but we also work with a lot of small companies. You'd be surprised in the challenges that these small companies have to set up a program, to administer those programs, and make sure their employees really have all the access to quality care and understand how to navigate this terrain that we have in the healthcare system, where to go, how to ask the right questions. So that's a big part of what we do.
Well, and I think too, for small businesses, the difficulty is you're competing out in the workplace for good employees.
Right.
And as a small business, you don't have that same bag of offerings that a giant company's going to have.
Right.
So to be able to kind of come up with things that would still be attractive to help you attract those good employees and keep them.
Yeah.
You've got to be creative. So, and obviously healthcare is a big issue.
Yep.
So you want to talk a little bit about the whole healthcare thing, and
Sure.
then we can come back to Ellen and Kay about their end of the spectrum.
It all ties together.
It all does
We're all
come
part of
together.
the same community and the things that we do together. But with the healthcare reform, it's a big deal. And I was on healthreform.gov, which is the main website that's kind of giving the information about healthcare and the reform that we're going through right now. And according to the government, about 60% of small businesses offer a healthcare plan. So that leaves about 40% of businesses that don't. And so there's so many new ways to offer a plan to your employees. All the insurance companies that I know in Jacksonville have all come up with new programs, new networks. They've established new networks that are about 20 to 30% less in cost for these health insurance programs. They've come up with new HMO programs. One of the carriers that came up with something pretty creative a couple of years ago, and it's still going on today. I'd like to share a little bit about that.
Sure.
Really what they've done is they've lowered the cost for the employer. The company only has to contribute down to $50 per employee.
Is that on a monthly basis?
On a monthly
Okay.
basis. And what they've done is, so if you break that down in just simple terms, that's only about $12 a week. It's only about 30 cents an hour pay raise if you work a regular 40-hour week.
Okay.
It's very affordable. And on top of that, it's pre-tax, and the employer doesn't have to match the FICA cost when an employee buys that part of their benefit. So it's very affordable. The other thing is the company only has to have 50% of the employees participate. It used to be that 70 or 75% had to participate, which would limit, a lot of companies didn't have enough employees to actually buy into the program. So just to give an example, let's say you have 10 employees, okay, and you want to have, you think, well, 50% you'd have to have 5 enroll in the program. Well, that's not really true. If you have employees that have coverage with their spouse, they're on Medicare or TRICARE, they don't count against those numbers. So let's say you have 10 employees, 2 of them have coverage with their spouse, so it leaves 8. So you actually only have to have 4 of the 8 employees participate. It's very easy now to set up these kinds of programs and make sure they have coverage. And one of the important things is why you buy group health insurance is for pre-existing condition coverage. Limitations on the federal government and the state government says that businesses that offer small group health insurance, the companies have to basically do that where there's no pre-existing conditions. So if you try to buy individual policy, you may be excluded from coverage for maybe a heart condition or cancer or something like that. But on group health insurance, you can get coverage for that. So a lot of
Interesting.
businesses should be offering it to their employees.
Now, I'm sure there are a lot of businesses that are not aware of it, hopefully now that they are. Okay, but let me jump back over to the ladies here, because urgent care is probably something that people are confused about. Does that mean I'm having a heart attack and I'm in the middle of it and that's the only time I can go there? Or so could you clarify that?
Sure.
I'm sort of tossing that ball to both of you.
Okay. Well, urgent care, basically, certainly a heart attack would most likely be seen in an emergency room because it's more of an emergency. Urgent care is something very similar to a primary care's office in a way. These are things that can be injury and accident. It can be, upper respiratory infections, blood infections, something that is more, I'm going to say a little bit less of a level than the ER would take.
Okay.
They can come there, they can be seen, they can be evaluated. It's a walk-in, so they don't have to wait as far as scheduling an appointment. Sometimes they would be seen in their primary care's office, but the office is too busy, and so they can't get worked in for 3 or 4 days. Well, unfortunately, respiratory infection may not wait 3 or 4 days, so it's great that they'd have a place to come in to it.
Now, what if somebody does not have a primary care physician?
And a lot of people don't have primary care
Well,
physicians. Well, they don't. I mean,
Yeah.
their numbers show it, but not only that, if you looked at the stats now, probably compared to 2 years ago, it's even less people that do. And we also have a generation in the 20s that are coming along, and they were not brought up that primary care was something that most women had. So you're also seeing that they're not doing that. So a lot of people don't have primary care, so they can still come in to see us based on whatever complaint they have. If it's something that, again, is an acute, meaning it's kind of a one-time episode, that's taken care of. If it's a long-time problem, like a hypertension would be, again, a chronic problem that you need, continued observation, diabetes, things like that, we will refer them to a primary care. So, we have roles with both. We'd like to make sure that when we see any patient, even if they do have a primary care, hopefully they do, that we refer them back to their primary care. We send information back to the primary care so they're also know that they've been evaluated.
Well, here's some interesting statistics. There's about 46 million folks that don't have insurance, that are uninsured.
Right.
And of course, we know that's growing every day. And a large portion, as Kay has said, is that many of those don't have primary care physicians. You couple that with information that has come out from the American Medical Association, which is it's about an average of 18 days to get into an internist and over 30 days to get into a specialist. Further having pressure, I mean, where are these folks going to go?
Right.
So many of them go to the emergency room, and that's very, very costly, plus the amount of time that's spent in the emergency room. So an urgent care really fits a niche to help with those from in the middle of primary care and to the middle of the emergency room, to be able to help service those from an easy access as well as a much more reduced cost.
So now, I was just going to ask you about cost.
Sure.
Let's talk about cost and how that, cost. How does that fit in? I mean, obviously an emergency room is very expensive. When you have elderly parents, you know about emergency rooms. So where does the whole cost thing fit in?
Well, the average is, say an average cost at our place would be about $125 to $140. That would be on an average. And what we find for comparable services in the emergency room is over $500. And I pulled off some statistics from Wisebread, which focuses on personal finances and frugal living, and they report a couple of things that I thought were quite interesting. Pink eye, very irritating. It's not life-threatening. If you go to an urgent care, the average cost is $102. And if you go to emergency room, it's about $370.
Wow.
Bronchitis, something that we see quite frequently in our center. The average urgent care center charges about $127, while the emergency room averages close to $600. So it's
It's a huge.
yes, huge
Very
difference
huge.
in terms of what costs can be.
Now, how does insurance factor into a facility like yours? I'm assuming you all take insurance.
Right, absolutely.
Okay, so if I'm on, and maybe you can weigh in on this too, Ray, if I'm on, I work for a small business or I own a small business, and I'm on one of these HMO type plans where, I've got my primary and maybe it's Saturday and now I've got blood gushing from somewhere or whatever. I need some immediate help, but it's not a 911 kind of a thing.
Okay.
We're dealing with in network, out of network. I'm just laying it out to the three of you. How do
Yeah.
you weigh in on that? Are things like that covered? And maybe that's more a Ray question, or I don't know.
Well, I think, and you bring up a great point, just in the the vocabulary, in network and out of network. I have a copay and I have a coinsurance, and what does this cover? When does that cover? So those are great questions, and I think where a lot of us need a little bit of help is just having an agent or a counselor or an advocate, a consultant, somebody that knows what these words mean and can be on your side to help you figure it out. So I would say in one part, education is a huge part of what health insurance and health care is all about. And finding someone that's really going to partner with you, a friend or family person that really knows what they're talking about, not just kind of knows, but really knows, that's really, for me, that's the first step in making good decisions, even in terms of, should I go to a doctor, should I go to an urgent care facility, what's it going to cost me? So that's just part of the conversation that we have a lot with our customers.
Okay, and so where does the whole insurance issue, Ellen, I'll address that to you, fit in with, somebody has insurance, it's a weekend, they need some immediate assistance. They can't wait for what did you say, an average of 18 days to get a doctor's appointment?
Absolutely. They can come into the center and they can be seen. And oftentimes with some of the insurance plans, we work very closely with what they have. We educate them to what we think the typical cost is going to be. The other is that some have very high deductible plans and they'd rather pay out of pocket rather than using their insurance.
Okay. Well, to me it makes sense that there's a facility that you can go to when you have a need for it. Because as you mentioned, there's a lot of confusion, there's a great time gap. I think it's a great concept, but, I have insurance. If I didn't have insurance, now what about the person who doesn't have any insurance?
They're treated the same way.
Treated the same way,
They
and-
come in, they're evaluated. We try to give them up front what the costs are going to be. We hopefully have made it as reasonable as we can that anybody can come whether they have insurance or not. And so they know, and before we move to the next step, they always know what something might cost, and if that's something that they feel okay with, we're all right with it. If it would be a life-threatening thing, we'd do it anyway. It wouldn't really matter. But I think we're pretty straightforward, and I think our prices are reasonable that somebody can come in and be evaluated. Because we actually had those questions initially when we opened, some of the first questions. Well, I don't have insurance, can I come? And it's like, of course you can. Of course you can be evaluated. So we're hoping we're helping in that area too.
Well, and here's the other element to think about, which is lost time from work. So someone needs to get access. Well, when you're talking about the difference of waiting 15 to 20 minutes to go and be seen by a physician, and an average in and out time of an hour versus some of the statistics that we're seeing coming out of the emergency rooms at 4 hours plus, that's a huge difference, and time lost from work.
Absolutely.
Yeah, I have found through various medical emergencies, like I said with the aging parent, if you come in via ambulance, you get in a whole lot faster. If you come via your own steam, you're sitting in that waiting room for 4, 6, 8 hours sometimes. So time can be a huge factor.
Well, and emergency rooms are staffed and they're ready for the highest acuity level. And so when you've got urgent care type things coming in, that's really just clogging the system, really, so to speak.
Now, if somebody doesn't have insurance, but they want to take a little bit of a proactive stance, maybe they think I need to have something checked, can they come into a facility like yours and do some, I don't know, maybe diagnostic or what's the word I'm looking for?
I think diagnostic might be it, but I'm not sure how specific you're being. It depends on what they're looking for. If they think they have a respiratory infection, they come in, obviously the physician's going to evaluate them, decide do they need a strep test, what kind of testing do they need. If they want to suggest something, that's fine too. I don't know that most people would come in and say, I want an x-ray. I mean, I don't, that's not typical, but it certainly could be ordered if it was needed after the physician had evaluated them.
Okay, so they're coming to you because they happen to have more of an immediate problem, rather than a wellness sort of approach to things.
Okay, I see what you're saying. Yes,
Yeah.
usually they're
Sorry,
coming.
I wasn't very clear with
no,
that.
No, they're coming in because they have a problem normally.
Okay.
They're normally coming in because they have a problem. If they're looking at wellness, it's not something that can't be done, but that's not the typical role of the urgent care, and we're also trying to be very careful that when they do have a primary care, if it is something that the primary care should be evaluating, that's pretty much where they would be served best. Now, if it's after hours, if it's on the weekend, I think we do a good job of helping out with the primary cares, that we are open and we can offer those services to them.
Okay. Ray, I want to come back to you because I want to talk about some other benefits. We're talking about the health care, and our show is geared to small businesses, and
Right.
and you mentioned one program in particular, but what are maybe some related benefits that a business owner might consider that's still affordable for them, again,
Right.
positioning themselves to be, a good place to work?
Yeah, if you take one of the programs I was just talking about, and let's put together another program to kind of layer on top of that. Some of the big companies offer things like dental insurance and disability coverage, short-term disability or long-term disability coverage, or a vision plan, those kinds of things. In today's marketplace, some of these large insurance companies have kind of got into the market for they've saturated the market. So they've gotten probably 93% of large companies all have programs like that. So they know that now's the time where they need to reach the small business owner and reach the the employees of these companies to get these programs started. And the great thing about a lot of these programs, it can be down to 2 employees or even 5 employees, that low, where you can set up a voluntary program. Voluntary just means the employer does not contribute, but it's set up on a group policy, which means you still receive the pre-tax benefit. The employer, although the employer doesn't contribute to a plan like a dental or vision or disability, the employer does not have to match the FICA tax. The employee doesn't have to pay that, and they don't have to pay the federal income tax on that. So they went out, they get a better price, a better product because it's going through a group, and the employer wins out because you offer all your employees a great program. So you have a great health insurance program that costs less than $12 a week for the company, and you offer a whole spread of options to meet the specific needs of your employees. And then you don't have to pay any taxes on that. So it's really, in today's marketplace, if you're a small business, you can compete with any large company, hands down. There's no reason why you can't. And one of my encouragement to the community here in Jacksonville is, 40% of the businesses on average are not participating. It's time to shine in this area. We know that we know that the employers in Jacksonville care about their employees. They care about them. They want them to be successful in whatever they do. And now's the time to be different. It's the best time to attract and retain quality employees, and to get them to stay longer at your company. And you can do that now, but it's so affordable. It's become, the insurance companies know with the healthcare reform that's going on, they have to make it easier. They have to make it more affordable. And so they're really making those steps.
And that's great to hear because, I remember years ago the Chamber was trying to put together a program, an insurance program, where if you were a member of the Chamber,
Right.
And you might be just a single
Employer.
it was just me, you know, where you could, because of your Chamber membership, you could kind of buy into that group. And then I think some laws changed or something,
Right.
and that only worked for a short period of time. An association type of a thing. So to see that the insurance companies are now coming around and coming up with things that are affordable for so many business owners out there, it's crucial.
Yeah, I think now's the time to investigate it. So if you're watching this program, now is really the time to look at what's going on because it's changed. It really has changed. Sometimes I think that employers don't take that step just because they've heard over years that, it's not going to work out, or maybe their friend's a business owner. Every company's different based on your age of your group of your employees, or their average, if they're gender, or they're more female or male. The rates are very different per company. So anytime you hear something like, well, it didn't work for me or it's too expensive from somebody else, that's not necessarily true for you and your company. Yeah.
Now, I want to kind of come back to you ladies because obviously there's some sort of benefit for business owners or their employees by creating a relationship with your organization. Is that correct?
Yes,
hope so.
definitely.
Okay.
Right.
You want to talk a little bit about
Sure.
that?
In addition to the urgent care services, we also provide workers' compensation as well as occupational health. So we can do things such as drug screenings and physical exams of all types and really help employers from that standpoint.
Now, do you have any particular program that you market to small business owners to make them aware of some of the services that you provide, or?
We have a very aggressive marketing plan, and so through our relationships with a lot of different entities around the community, that's really how doors are opening for us to be able to talk with small businesses. So by virtue of a relationship with the Small Business Development Center, with the Chamber of Commerce, and those type of Visit Jacksonville, those type of entities, we're working hand in hand with small businesses and large businesses too.
Well, and I think it's a great concept, and I'm curious how the two of you decided to do this. What prompted you to start Doctors Express?
Good choice.
We've been friends for a long time, and our children were actually we met through our children the age of 3, and they're now 18.
Oh my goodness,
And,
pals from way back.
Yes, had a tremendous respect for Kay. She's very much a beloved gynecologist, OB-GYN gynecologist here in Jacksonville, and very passionate about healthcare. And just knowing her as a friend and trusting her, we said let's try something together. And we did a lot of due diligence around companies, and we found out that this is really one that works very well for us. We believe that we can really make a difference here in the community of Jacksonville.
So what are some of the results? First of all, how long have you guys had your centers open?
We open October.
Oh, brand new.
Yes.
So what kind of results have you seen, or you know what I'm saying? You opened in October, this is now May. What's the results?
It probably goes back to looking at our surveys, which we're doing that on our patients, looking at how they feel about it, and it's been a very positive response. It's nice and friendly people when they come in. The wait time is reasonable. The physicians had time, to talk with them, answer their questions. So I think it's been well received in that respect, that there is a need for it. The entire way that healthcare is being delivered obviously is changing. There's no question about that. In the years past, when you did have the primary care, and you still had the primary care, and you had the ER, those were really your only two choices. Normally, whether it was a weekend or what, those were your only two choices. Well, by bringing urgent care, the whole concept of it, now you're bringing a whole other way of delivering health care. It is available on weekends. It is available late in the afternoon when people get off work. So this is an advantage to most people. They don't have to leave work early to get checked because they have a respiratory. I mean, certainly if they're bad, I
Sure,
don't mean that.
sure.
But I mean, if they're reasonable, they can wait until 5 or 6 o'clock, stop on the way home before they pick the kids up, and they can be evaluated. So that is a whole nother concept that we can offer to the patients.
Well, and I think the whole customer service aspect of this is what's amazing. You look back probably 50 to 100 years by now, where the doctor would come to the house. You've got
Yes.
the croup or whatever,
Yes.
the doctor comes to the house. And then it just kind of got bigger and bigger, and then you got longer and longer lines, or I don't mean lines necessarily, but times between, okay, I don't feel good now, I can't get in to see you for 18 days, well, I'm probably well by the time that time comes around, or I'm dead, one of the two, So
Well, you
this
have
whole
small
idea of, holy cow, what a concept. I can spend time with the physician. I can get an explanation of what's wrong
Right.
with me. And I can do this on a Saturday morning at 8 o'clock when it's occurring and not have to wait 18 days. So I think the whole customer service aspect of
Right.
this is
It's
almost phenomenal.
It's a very positive part of it. There's no question about it. The primary care plays a big role. We're not changing that in the least bit. We just want to be there at other times or times when they can't get in to see them. Back to your doctor walking around with a little bag. I've actually made house calls on a couple patients years ago, which was very nice. But communities were small when people were able to do that. As communities have gotten larger and the volume has gotten larger, you just don't have enough physicians that would be able to make those house calls. So, then you go back to the office. Then that gets bigger, and so, what do you offer next? Well, now we offer a different way to deliver health care.
No, I think it's great. I want to jump back to you, Ray, because it seems to me there's some tax credit kind of programs, or
Yeah.
right? You want to address that issue?
Sure.
Because I think, when business owners hear healthcare, they're immediately, their eyes glaze over and they're thinking big dollars, it's going
Right.
to cost me a bunch of money. But we've already talked about some things that are much more affordable.
Right.
And then you tack on this whole idea of actually getting what a concept, a tax credit.
Yeah.
So you want to talk a little bit about that?
Yeah, actually, and on top of being able to get a deduction, now if you're an employer and if whatever dollars you contribute towards your health part of your program, you can get a deduction off of your taxes. That's great. Well, for 2 years, it depends on when you start your program. For about 2 years, you can receive up to 35% tax credit from the government as a small business. And so basically, as long as you contribute 50% of your employees' coverage, their cost, you can receive up to 35% off in your taxes as a true credit, not a deduction.
I was just
a
going to
true
say,
credit.
it's a credit, not
Yeah.
a deduction,
It's a
which
big
is
deal.
a much better position to be in.
And you can do that for 2 years, and then after 2 years it goes away. But the way the healthcare reform is set up in 2016, you can receive even more tax credit depending on how you purchase your health insurance.
Do you have, this is a really off-the-wall question.
Sure.
In your crystal ball of things, do you have any sense of
What's going on?
what those guys in Washington are going to do to this whole program?
I have spent so much time reading through material and going to programs and listening. We spent a lot of time doing that. Of course, that's a big part of what we're involved. There really is no crystal ball. As you know, some things are repealed recently, but overall, what I believe in with healthcare reform is that a lot of things are going to continue to go through. There's a lot of good things that are happening in healthcare reform that are giving people more access to care, and there's some things that other people don't agree with. But what I do know is that things are going to continue to move forward. Little parts and pieces of things may change, but probably for the most part, it's going to continue to go through its course.
Okay. Why do you think employers are not doing this?
They're not jumping
Are not jumping on this?
on the healthcare reform.
Yeah.
I don't know. I think, partly maybe it's the economy. Really, there's a lot of, I'm not sure where things are going to go in the future. I'm not sure I want to take that step. And one of the things I would encourage you to do on healthcare, it's a month-to-month relationship with an insurance company. You're not into some other insurance contracts require a year
Okay.
that you have to be engaged with that contract. With health insurance, it's month-to-month. So if you pay for a month of premium, you get a month of coverage.
Okay.
If you stop paying it, your coverage is stopped. So there's no reason maybe to say, well, I'm not sure what the economy is going to do in the future. Go ahead and take that step. At least get the coverage for now, and if things change, you can terminate the policy. You don't have to wait.
Well, and the beauty of an organization like Doctors Express is, if you don't have the insurance, I mean, it's great if you do
Right,
have it,
right.
but if you don't have it, then at least there's a facility that you can get the help that you need very timely with great customer service and people that are willing to spend time with you to make sure you understand the situation and what needs to be done, et cetera. So it's a very good blending of services here. And I congratulate you guys on your new business.
Thank you.
Thank you.
It sounds like you've been real successful right out of the chute here.
We're working hard,
Good. Good.
enjoying it.
Well, good. Well, I think we are out of time, so I want to thank you all for joining us. You in the audience, thank you for joining us today. And remember, health care can be affordable for you. So investigate it. And come back next time when we'll be speaking of business. Bye now.